Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. Danielle Doucet, and we're here to talk about varicose veins. So my first question for you is, how do varicose veins develop?
Varicose veins develop from back pressure being built up in the venous system. The veins have the job of bringing blood flow back from your feet back to your heart. They're a relatively elastic and low pressure system that need the help of your muscles to bring blood flow back. When the veins are working against gravity, they need little way stations in between the muscle contractions to keep the blood flow from returning back to the ground or back towards your feet. And when the valves themselves become damaged, you can get back pressure being experienced in the veins, and that back pressure can cause veins to dilate and more backflow present in the veins. And it can be then transmitted to the side branches of the veins, which allow varicose veins to elongate and become enlarged.
Can they cause health problems, or are they only a cosmetic problem?
Varicose veins are a spectrum of a disease. So there's patients that have primarily cosmetic concerns, and then there's patients that have very severe disease processes that can lead towards ulceration. The overall location in the spectrum depends on the presentation and how the patient's symptoms are affecting their overall lives. Patients have aching and throbbing pain in their legs that can increase and worsen throughout the day. These symptoms can prevent them from being able to stand or walk or exercise, and can start interfering with their activities of daily living. Then if you fast forward to more severe disease processes, these patients can get swelling and collection of fluid in their skin, and that can develop skin thickening, increases their risk of infection and skin ulceration. The risk factors for development of varicose veins is, number one, hereditary causes. Number two would be patients that stand or sit for long periods of time or lack significant exercise in their life, having a sedentary lifestyle. Number three, patients who are overweight. Obesity does increase your risk factors. Number four would be smoking. Smoking does increase the damage to your blood vessels and increases your chances of developing varicose veins. Prior trauma can increase your risk of developing varicose veins, and multiple pregnancies and just being female overall does increase your risks.
Can you talk about lifestyle changes or medical procedures that can treat varicose veins?
There's always conservative measures that we can do in order to improve patients' symptoms overall. So increasing your daily exercise, maintaining a normal healthy lifestyle, having a normal body weight is always helpful. But for the patients that have to stand or sit for long periods of time, compression stockings are beneficial to treat the symptoms and can actually help to stabilize venous disease at its current state.
What's the difference between varicose veins and spider veins?
Varicose veins are larger, they're 3 millimeters or larger by definition, and can cause significant symptoms. Whereas spider veins tend to be flat. They can be multiple different colors, blue, purple, red, and they can present all over the body, although there is a predominance in the lower extremities. And they tend to be relatively asymptomatic. They're more of a cosmetic concern.
What type of doctor can treat varicose veins?
Varicose veins are treated by multiple different types of physicians. However, a board-certified vascular surgeon is uniquely qualified to evaluate and treat patients with lower extremity symptoms, given our broad training.
Are varicose veins considered to be a serious health issue?
Varicose veins can be, again, primarily cosmetic, or they can be a marker of severe underlying disease. Patients that should seek treatment when they have symptoms in their legs that are affecting their activities of daily living, and or when signs in their skin quality in their legs have started becoming compromised. So anytime that patient has some brownish discoloration in their skin, irritations, recurrent episodes of cellulitis, they need to seek treatment for their lower extremities and for further evaluation.
Is age a factor?
Varicose veins can start as early as the teenage years and become more prevalent as we age. Over the age of 50, I want to say a quarter of Americans actually already have some existing varicose vein disease.